Good evening. This presentation highlights the use of mobile phones in healthcare, which we otherwise called mHealth. mHealth is nothing but use of any mobile device like mobile phone or tablet, laptop for collecting the data, for storing the data, for sharing the data, retrieving data for healthcare purpose. Here in this presentation, I will give an example of one project from Africa where TMU is running Taipei medical mission, and you will see how we use mobile phones to deliver lab results from laboratory to the clinics which are in the villages, and how this has turned out to be very effective, although it's very simple project. So now I will explain with the help of one project which we have done in Swaziland, which is one of the country in Africa, and say how this project helped those people there. So the project is about lab push. We called it lab push. It is about very simple strategy like sending SMS lab results of to the clinicians via SMS, and the project is called LabPush, a pilot study of providing remote clinics with laboratory results via SMS in Swaziland, Africa, and this paper was published in PLOS ONE journal. Three different institutes were participating. One is Taipei Medical University, another is Taipei Medical Mission, and the third one is National Referral Laboratory. National Referral Laboratory is basically from Swaziland, the government's own laboratory where investigations for blood investigations will be analyzed and sent all over the country. Okay, here I am showing the map of the Kingdom of Swaziland, and I will give a brief introduction about the country, why we have chosen that country, and about why we have chosen to send SMS, because sending SMS is not any, it's not an innovative thing, but the good thing is that we have evaluated how this sending of SMS to the clinicians in the remote area is going to help them to take decisions. Swaziland is a 1.1 million people country with a handful of hospitals and about 100 clinics spread all over the country. And the particular thing about Swaziland is they have very high prevalence of HIV and tuberculosis. The rate is so high, it's almost about 26%, meaning every third or fourth person you meet will be HIV infected. TMU is leading a Taipei medical mission. That means we have a intergovernment agreement to provide healthcare services in Swaziland, and Taiwan is committed not only for providing the healthcare but also to provide capacity building and technology transfer to Swaziland. Professor Jack Lee with team members travel to the Swaziland in order to know the actual problem people they are suffering with and to see how technology can help them, because all problems cannot be solved using technology. So that was the main reason we want to go there. We want to see how things can be improved and how we can help those people using technology. So here you see the photographs, people discussing, Professor Jackley discussing with the staff in the national lab, and this you see there are a lot of computers, and also you see everything is computerized. They have very good LIS, that means laboratory information system. And the thing is that in spite of having these advanced machines and laboratory information system, they end up with keeping all the reports in a pigeon box at the corridor of the lab, and staff from the clinics from the periphery will be traveling and collecting their own reports. There is chances of error, keeping results in another box, pigeon box, and people taking the wrong reports and they will never return back to it, meaning many reports are going missing. So during our study we also evaluate what are the missing rates of reports when using this paper system. Then we have discussion with different peoples both in laboratory and the clinics, and we found out what is most appropriate technology that help them to solve or mitigate the problem they are facing with. And this is the team, our team, and also people from Swaziland discussing how we can work out a project or plan which will help them to provide the lab results at the earliest. Turnaround time should be reduced, and also missing rate has to be reduced. So these are the things we came out from our discussion, that almost the CD counts and most important things, the examinations of a blood are sent to the national referral lab using courier, meaning staff will be carrying blood samples to the laboratory. The results at lab are ready within 2-3 days. However, the results are kept in the pigeon box and they awaited for staff from the clinics to come physically and collect the reports. And practically it takes 2 to 3 weeks, because the staff come back to the lab only when they have enough amount of samples collected, so that they will give the samples to the lab and collect results of the previous samples. That is how they work. So this process take actually from some weeks to probably 1 month or 2 months. Also, physician at clinic needs to wait until they receive lab results in order to take treatment decisions. So after discussion with the clinicians and the staff at the lab, we decided, okay, let's have a joint project between Taiwan and Swaziland to deliver clinical information wirelessly and efficiently. And the aim of the project was to shorten the delivery time of lab results. And we want to use SMS just to send lab results to the clinicians in the remote villages. This is how it works. Whenever the physician at the clinic orders a blood result, the clinician, the nurse will be taking the sample, sending to the lab as usual. There we can't do anything much, but once the lab results are ready and at the lab, from there our project starts. Meaning we train one staff at the lab that he can export all the results from the clinic where we are having intervention, and send all those and upload those information to our system. Here in this picture you see we have provided a hardware to them where they can just input a Excel file with the name of the clinics and addresses, and then the system will automatically generate SMS with the mobile phone number given for the for that clinic, and send to all the blood examination requested by that clinic to them, and that too only for one head nurse who is responsible of lab results. And nurse was told or trained to maintain a logbook and to register the date, time and ID of patient and lab results when they received, whether it is paper or whether it is SMS. And other thing is that we have not disturbed the normal paper flow of results, meaning we want to see, okay, which one is going to come first, delivered first, either paper or by SMS. In that case, by how many days and so forth. So you will see in the results how this works. So here I talk a bit about methodology. That lab push was implemented in 6 clinics of Swaziland, and 6 other clinics were taken as control group, and SMS were sent out from laboratory as a supplement to normal transport of paper results sending SMS. Each clinic was equipped with mobile phone to receive SMS phones, and the lab was equipped with lab push system, which I have shown in the last slide, that can transmit result via SMS to the clinic. And here you see the display of mobile phone with received lab results via SMS. If you see, you can the picture here, you see the name of ID of patient, name of patient, and the required blood investigation results are shown there. And this was not enough. What we did is that if you see our results table 1, the number of paper and SMS record that arrived at least one day earlier for each clinic, and you see there are 6 clinics, and both received paper and SMS. Now we are comparing which has how many paper results they have received, how many SMS they have received. And if you see in few clinics, SMS are more than paper received. For example, if you see clinic 6, there are just 446 paper received, whereas 522 paper SMS received. And also there are some cases where both arrived on same day. And in table 3 you see that how many were missing, because we were also worried about how many were missing. If you see here, 76 paper results were missing in this 3 month of our study, and there were 9 SMS missing, that was on same day because of some technical problem. The results shows, statistical analysis shows better results for SMS based delivery. And you see the maximum and minimum gain of days, here we mean by days. And if you see clinic 1, 2, 3, almost up to 1 month of gaining of using SMS they are getting, meaning if they use paper, results were arriving 1 month later, then they get SMS. So that is how our system is working. However, it is very simple system, but it proven to be an effective one. SMS based reporting of lab results has potential for reducing turnaround time and loss rate or missing error reports. The results were significantly better for SMS compared to paper reports. SMS based systems aid physicians to make clinical decisions much earlier than paper based. And in conclusion, we say definitely this is a preliminary evidence that SMS supporting clinical critical laboratory results to clinics has improved turnaround time of lab in Swaziland. Missing rates of tests are reduced significantly. Benefits from this system are noted to be greater to the clinics which are far away, and further studies are needed to evaluate cost effectiveness and clinical outcome. Also, I recommend few videos and presentations talking about mHealth, and there are different other projects and different various ways how the project can be helpful. Thank you.